It's been a fantastic 2 days with teams from across Wales. We've had a brilliant turnout. We've got some new members of teams joining us over these 2 days, and we've spent a lot of time working with them within the work streams to build that collaboration across Wales. Over these 2 days, we've had a mix of staff from across organisations and across levels within organisations. So we've had some executive directors, we've had clinical leads, we've had multidisciplinary teams, we've had improvement teams, data teams. So there's a broad range of people that have been here to support and work together to improve those patient safety priorities. The Safe Care Collaborative aims to build sustainable improvement capability within organisations focused on patient safety. It aims to show measurable improvements in patient safety priorities across Wales and support organisations in building their learning culture. Two of the sessions that I think teams found most useful, one was provided by our Improvement Cymru Academy in tools to understand the problem and start understanding and diagnosing some of those areas for improvement, and our Academy can provide support on a range of those approaches across Wales. The other session I think was most important was looking at the coaches network and how do we learn from each other and how do we share our improvements but also some of the challenges and tactics that people are taking to embed this approach within their organisation. Our next Safe Care Collaborative will be really focusing on teams showcasing what they've been doing with their learning and how they have demonstrated their improvements to date. It's going to be a fantastic opportunity to showcase how teams have made that start in their journey and what they've learned so far, and we hopefully through that can share some of how they've broken down those barriers and how they've overcome some of those challenges, but also spotlight some of the real successes.